Hi, this is David Schneider with Pure Orthopedics, part of Panorama in Colorado. I'd like to talk about shoulder replacement surgery. Used to be we thought about orthopedic anatomy in these simple type of pen and ink drawings. This is from Gray's Anatomy. And while this conveys a lot of information, it's certainly not how we think about orthopedics and the function of the human body now. Instead, it's more like this. This is a drawing from Netter. It's really complex, but I'd like to boil it down and think really in a basic sense to what the anatomy of the shoulder is. The most important part of the anatomy in the shoulder is in the deepest part. And that's the articular cartilage surfaces in the glenohumeral joint, both the articular cartilage on the humeral head and in the socket of the shoulders, the so-called glenoid. And it's this cartilage, if you zoom in on this even more, you'll see that the articular cartilage is layered and has very discrete functional jobs based on the level of the cartilage. And it's these zones that really determine the health of a joint. Superficial zone is really the most important, and that's where the connective tissue fibers are really have the greatest integrity and are the most slippery. And in a cartoon format, in this superficial zone, you'll see these so-called proteoglycans have their fibers oriented in line with the surface of the joint. And this is the case in any joint in the human body. Here in a cartoon of the knee, you can see the cartilage is lost and the inside part of the knee. And this cartilage is no longer functioning and is quite painful. So in a word, when an orthopedic surgeon speaks of arthritis, what they're talking about is damage to this slippery cartilage surface. And in the shoulder, when the cartilage goes bad, it becomes inflamed. Little lumps and bumps grow around it on both sides, on the humeral head and the glenoid socket. And this is arthritis, the loss of the cartilage. Now on a plain x-ray, you see the articular cartilage is still intact. It's invisible on this x-ray, and that's why it looks like there's a gap where the blue arrow is pointing. Now, when that cartilage goes away, and in early arthritis, it becomes bone on bone, and that gap is gone where the red arrow is pointing. Now it gets worse as most people get arthritis. These large so-called osteophytes grow, and I've outlined this. And it kind of works like this wedge and limits someone's range of motion. And until these lumps and bumps go away, you can't move your shoulder, no matter what type of injection you have, for instance. Now in this case, you can see I'm drawing a line from the center of the socket to the center of the humeral head, and at least it's aligned. But with advancing arthritis and a rotator cuff tear, the humeral head rises up and the humeral head is no longer centered in the socket. So in this high-riding humeral head, we call this condition cuff tear arthropathy. That is to say, a type of joint disease that happens with long-standing arthritis and a rotator cuff tear. What are the options if you have advanced arthritis? That is to say, if you've lost the articular cartilage. Well, you can rest, try and do some exercises, take anti-inflammatory medicines, have steroid joint injections, topical creams, but oftentimes those don't work. And similarly, these fancy and extremely expensive injections, so-called stem cell injections that oftentimes aren't real stem cell injections, depending on who's doing it. Oftentimes, if those measures don't help, then surgery becomes an option. And the most well-known of those is a total shoulder replacement. Well, what do we know about shoulder replacement surgery? It's proven and reliable, it's long-lasting, and the patient satisfaction is very high. Here's a photo of my hands holding the first total partial shoulder replacement done by Charles Neer, the modern father of shoulder surgery. But what is a total joint replacement? By definition, a total shoulder is when both sides of the joint are resurfaced. And polyethylene, that's to say a polymer, a plastic, is used as a cushion in between. Here's a photo of a total knee, and you can see there's a thin metal lining at the end of the femur and the top of the tibia, and with an interposed polyethylene implant there, which provides for low friction interface. Here's a drawing of a total hip, and here's amazingly what a total elbow looks like, and I do plenty of total elbow replacements as well. Again, getting back to this photo, this is Dr. Neer's implant, but it wasn't modular back then. Back then it was just one piece, a single piece where the stem and the ball were just made as one manufactured component. We don't do it that way anymore. We have what's called modularity. And this is one of the world's most successful total shoulder components. This is by Biomet, the so-called Biomet Comprehensive. There's a stem, an adapter, a specialized humeral head, and then the polyethylene with a special metal peg. And when you put all the pieces together, it looks like that. So modularity gives us incredible flexibility, and we can customize this. And with preoperative computer planning and templating, we can come up with a perfect fit and perfect x-rays, as opposed to what was first designed back in the 1950s. So this is what a total shoulder looks like. Artist did this drawing for me. A total shoulder replacement. The stem goes down the humeral stem. It's fully in the bone. And again, it's perfectly sized. We have many, many options. The head is mounted on there, and we're just trying to recreate what Mother Nature had. And then the polyethylene, the pegs get pounded into the shoulder socket. It gives you an incredibly well-conforming, low-friction, pain-free joint replacement. Now, this is in comparison to a reverse shoulder replacement. Big difference. And a lot of people are confused how a reverse works. So again, this is a standard total shoulder replacement where we're just resurfacing and coming up back with the original geometry. But in a reverse total shoulder replacement, you can see the ball has been moved. It's reversed so that the ball is mounted on a base plate that's screwed in place. We use a similar kind of stem, but in essence, the shoulder socket now is where the ball used to be. And it works incredibly well for those patients who need it. So when do we do a reverse as opposed to a standard? Usually we do a reverse when there's a combination of shoulder arthritis and a rotator cuff tear, or if there's severe bone loss or a high degree of deformity, even in a younger patient. We do it in revision shoulder operation situations. We do it with severe fractures, and we do it for this type of shoulder. This is a photo from one of my friends at the Mayo Clinic. In this high-riding humeral head, we've seen a photo like this before, where the humeral head is going up and it's banging up against that acromial bone. Again, this is a high-riding humeral head. A standard total shoulder would not work for this patient. It would not help them raise their arm overhead. So here's a cartoon of what that looks like, where there's a stem going down, and again, that polyethylene is mounted on the arm side, not on the socket side, and it pulls it down. A reverse shoulder works incredibly well because it helps put tension and helps the deltoid do its job. So again, in this cartoon, you see the deltoid still works. It's always tried to lift the arm, but with the reverse, it brings the components down and allows a patient to use their arm. And I have lots of options when we do a reverse. Many different companies. Here's 3 of the main designs. And there's a lot of math behind this, but it works incredibly well. And it's really one of the greatest inventions in medicine over the last 50 years. So again, standard total shoulder, we're just resurfacing. And this works incredibly well when the main diagnosis is arthritis, but not a rotator cuff tear. But a reverse is used, again, in those conditions in which typically there's bad shoulder arthritis and rotator cuff tearing. And this is what it looks like from the armpit view, standard total shoulder versus reverse. And you can see these other components. On the left is what a total shoulder looks like, and on the right, this is what the reverse base plate looks like before we put the ball there. We have all kinds of choices. Here's just a small drawing of 29 different total shoulder companies. And again, as an experienced shoulder replacement doc, I've used almost every one of these or revised almost every one of these, at least those that are on the American market. Now, this is a new era, and now we have stemless total shoulder components where we don't have to put the big long stem, and it's much less invasive, much less destructive to the bones, and we're preserving a lot more bone, and this is really helping patients do better faster. This is one of the components that I use a lot. This is again from a company called Zimmer Biomet, designed by a French surgeon. And we also have brand new polyethylene, which much better wear characteristics, and you can see there's a wedge to this on the right side. We're able to use this for people who have bigger deformities. A very common question, and I'd say an area of great misunderstanding, is how long a total shoulder lasts. This is what we call this Kaplan-Meier analysis. This is from industry, and now we use this in orthopedics. It helps us understand how long something lasts. In this case, in this publication, Scandinavian publication, they followed patients for 10 years. You can see that's on the x-axis below, all the way out to 10 years. And implant survival is the y-axis, going vertically up to 100%. So in green, the green line, in this case, tracks patients who had a total shoulder arthroplasty, a total shoulder replacement. And then in blue is if they only had the metal ball put on and didn't have anything done with the shoulder socket. And then the black line is what if you just debrided? What if you just cleaned out the bone spurs? Oftentimes I get asked, can't you just clean it out, doc, and let's see how I do. Turns out patients who just have those clean out operations aren't as happy. They don't do very well, and they end up coming back and saying, I don't think that helped me very much, doc. I want something else done. So again, this is 10 years out, and amazingly, 10 years out in this study, 95% of total shoulder patients still had that total shoulder in place and were very happy and had not had a single other operation. So incredibly good results. So you can imagine to my ears when patients say, well, I hear they only last 10 years. It's just not factually, scientifically correct anymore. And this is one of those studies that show 10 years out, 95% of patients are going strong, have not had another operation. So we now know total shoulders last a long, long time. How do you achieve superior results? Well, it helps if you're being cared for by a surgeon who's in a practice with high volume, who is dedicated to doing that condition and that operation again and again. It's not just orthopedics. We see this in every branch of medicine, whether it's a heart surgeon or a surgeon who takes care of patients with gallbladder problems. If your team and that surgeon focus on that, the results are better. And it also helps to have a very experienced operative team where your assistants and the techs and the nurses are with you together for a long time. And it also is better if the surgeon tracks their results and they're involved in implant design and tech development. And you might guess, and I'm kind of hinting that I'm very lucky to be part of a team where this is true of all of us. And I'm very fortunate to be involved for many years, part of implant design and tech development, and where we track our results. And I'm very blessed to be surrounded by a very experienced team. And coming down the pike, very soon, our team is going to be involved, and we'll be very lucky to be really probably the first surgical team to use mixed reality combined with robotics. And this is coming down the pike, and we're going to be very excited to bring this to our patients. And that's really what Pure Orthopedics is about, is using the best minimally invasive, muscle-sparing techniques with the most advanced implants where we're tracking everything. And we would only use those implants that have the absolute best outcomes, and we use the best techniques. And everyone on our team, from the therapist and the technicians and the surgeons on down, are all dedicated to this. And that's how you get the best results. And that's why we call it Pure Orthopedics. Thanks for your time.